Hello everyone and welcome to Community Care Channel. Overdiagnosis and overtreatment are growing concerns in healthcare. They represent a silent epidemic that can harm patients both physically and financially. But what exactly do these terms mean? Overdiagnosis occurs when a disease is diagnosed that would never have caused symptoms or death. This often happens with early-stage cancers and other slow-growing conditions. Overtreatment, on the other hand, refers to the excessive use of medical interventions such as tests, procedures, or medications that offer little or no benefit and may even cause harm. Imagine a scenario where a routine screening detects a tiny, harmless tumor. This is a classic example of overdiagnosis. The tumor might never have caused any problems, but its discovery often leads to anxiety and fear. This can pressure patients and doctors to opt for aggressive treatments like surgery or chemotherapy, even when the risks outweigh the potential benefits. Overdiagnosis and overtreatment are intertwined, creating a vicious cycle that can negatively impact patients' lives and strain healthcare resources. Recognizing and addressing these issues is crucial for improving healthcare quality and ensuring patients receive appropriate and beneficial care. Prostate cancer screening, particularly the PSA test, provides a compelling example of overdiagnosis and its potential consequences. The PSA test measures the level of a specific protein in the blood, which can be elevated in men with prostate cancer. While this test can detect cancer in its early stages, it cannot distinguish between aggressive forms that require treatment and slow-growing tumors that are unlikely to cause harm. As a result, many men undergo unnecessary biopsies and treatments based solely on an elevated PSA level. These interventions can lead to complications such as erectile dysfunction, urinary incontinence, and even death, without necessarily improving survival rates. Studies have shown that while PSA screening may reduce the risk of dying from prostate cancer, the absolute benefit is small. For every 1,000 men screened over a decade, only one life may be saved. Meanwhile, hundreds may experience unnecessary anxiety, biopsies, and treatments due to overdiagnosis. The case of prostate cancer screening highlights the importance of informed decision-making in healthcare. Patients need to be aware of the potential benefits and harms of screening tests and treatment options. They should engage in open discussions with their doctors to make choices that align with their individual values and preferences. Overdiagnosis and overtreatment are not confined to specific geographic regions. They are global healthcare challenges. The prevalence and patterns of these issues vary across countries, influenced by factors such as healthcare systems, cultural beliefs, and economic incentives. In the United States, the aggressive approach to healthcare, coupled with a fee-for-service payment model, contributes to high rates of overdiagnosis and overtreatment. Studies estimate that up to 30% of healthcare spending in the U.S. is wasted on unnecessary or ineffective treatments. European countries with universal healthcare systems tend to have lower rates of overdiagnosis and overtreatment compared to the US. However, variations exist within Europe. For instance, countries like Germany and Switzerland, with strong private insurance sectors, have higher rates of certain procedures, such as cesarean sections and knee replacements, compared to countries with more publicly funded healthcare systems. In developing countries, limited access to basic healthcare services often coexists with the overuse of expensive and potentially harmful interventions in urban areas. This paradoxical situation highlights the need for equitable distribution of healthcare resources and evidence-based treatment guidelines. Understanding the global landscape of overdiagnosis and overtreatment is crucial for developing targeted interventions and promoting international collaboration to address this pressing issue. Section 4. Unraveling the root causes of overdiagnosis and overtreatment. The root causes of overdiagnosis and overtreatment are complex and multifaceted, involving a confluence of factors related to technology, medical culture, patient expectations, and economic incentives. Unraveling these intricate connections is crucial for developing effective strategies to mitigate these issues. Advancements in medical technology, while revolutionizing healthcare, have also contributed to overdiagnosis. Sophisticated imaging techniques, such as CT scans and MRIs, can detect minute abnormalities that may not pose any real threat to a person's health. This ability to identify abnormalities in their earliest stages, often before they cause any symptoms, can lead to unnecessary anxiety and interventions. Defensive medicine, practiced by doctors to avoid potential lawsuits, is another contributing factor. Physicians may order unnecessary tests or treatments to protect themselves legally, even if they believe the risks outweigh the benefits for the patient. Cultural factors also play a role. In many societies, there's a prevailing belief that more healthcare is always better, leading to a demand for the latest tests and treatments. Patients may pressure doctors for interventions, even if they are not medically necessary. Economic incentives further complicate the situation. The fee-for-service payment model, prevalent in some countries, rewards doctors for the quantity rather than the quality of care they provide. This system creates a financial incentive to perform more tests and procedures, even if they are not in the patient's best interest. Section 5. A statistical snapshot. Recent research on the prevalence of overdiagnosis. Recent research provides compelling evidence of the widespread nature of overdiagnosis, sounding alarm bells across the medical community. Studies published in prestigious medical journals reveal alarming statistics, highlighting the urgent need to address this growing concern. A groundbreaking study published in the BMJ analyzed data from over 500,000 patients and found that overdiagnosis occurs in various medical conditions, including thyroid cancer, breast cancer, and prostate cancer. The study estimated that as many as 1 in 5 cases of cancer diagnosed in the United States might be overdiagnosed. Another study published in JAMA Internal Medicine focused on the overdiagnosis of attention deficit/hyperactivity disorder, or ADHD, in children. The researchers found that children born in the final months of the school year were significantly more likely to be diagnosed with ADHD compared to their older classmates. This finding suggests that some children may be misdiagnosed based on their relative maturity rather than actual symptoms. These studies are just the tip of the iceberg, with growing research highlighting the prevalence of overdiagnosis across a wide range of medical conditions. The implications of these findings are significant, raising concerns about the potential harms of unnecessary medical interventions and the escalating costs associated with overtreatment. The growing body of research underscores the need for increased awareness among healthcare providers and the public about the risks of overdiagnosis. Promoting informed decision-making and evidence-based practices is crucial for ensuring that patients receive appropriate care and avoid unnecessary harm. Section 6. Empowering patients. Practical tips for avoiding unnecessary healthcare. Navigating the complex world of healthcare can be challenging, even for the most informed patient. However, by arming themselves with knowledge and adopting a proactive approach, individuals can significantly reduce their risk of falling prey to overdiagnosis and overtreatment. One of the most effective ways to avoid unnecessary healthcare is to engage in open and honest communication with your doctor. Don't hesitate to ask questions about the necessity of tests, procedures, or medications. Request clear explanations of the potential benefits and risks of each intervention, ensuring they align with your personal values and preferences. Before agreeing to any screening test, educate yourself about its potential benefits and harms. Understand that not all screening tests are created equal, and some may lead to more harm than good. Consider the potential consequences of a positive result, including the emotional toll and the possibility of unnecessary follow-up tests and treatments. Be wary of direct-to-consumer advertising for medications and medical devices. These advertisements often exaggerate the benefits and downplay the risks of these products. Consult with your doctor to determine if a particular medication or device is appropriate for your specific situation. Remember that you have the right to refuse any medical intervention even if your doctor recommends it. It's your body, and you have the ultimate say in your healthcare decisions. If you're unsure about a particular treatment option, don't hesitate to seek a second opinion from another healthcare professional. Section 7. A collective effort. Global initiatives tackling overdiagnosis and overtreatment. Recognizing the growing threat of overdiagnosis and overtreatment, organizations and initiatives have emerged worldwide to combat this complex issue. These collaborative efforts aim to raise awareness, promote evidence-based practices, and empower patients and healthcare providers to make informed decisions. The Choosing Wisely campaign, launched in the United States and now active in over 20 countries, encourages medical societies to identify and question commonly used tests and procedures that may be unnecessary. By providing evidence-based recommendations, Choosing Wisely empowers doctors and patients to engage in conversations about choosing care that is truly necessary. The Right Care Alliance, a global coalition of patients, clinicians, and researchers, advocates for a more patient-centered approach to healthcare. The alliance promotes shared decision-making, transparency in medical information, and a shift away from the overuse of medical interventions. Several countries have implemented national initiatives to address overdiagnosis and overtreatment. For example, the United Kingdom's National Institute for Health and Care Excellence, or NICE, develops evidence-based guidelines for the diagnosis and treatment of various medical conditions. These guidelines aim to standardize care and reduce unwarranted variations in medical practice. These initiatives, while making significant strides, represent just the beginning of a long and challenging journey. Addressing the deeply ingrained cultural and economic factors driving overdiagnosis and overtreatment requires a sustained and collaborative effort from stakeholders across the healthcare spectrum. By working together, we can create a healthcare system that prioritizes patient well-being, promotes evidence-based practices, and delivers truly valuable care. Thank you for watching, and don't forget to subscribe to our channel.